Here to introduce to you Dr. Kristen Vandenberg. She's assistant professor, University of Colorado, Colorado Springs, and she has as her title, AI for Resilience. Now, again, we all like resilience. We need resilience and combating nursing burnout and boosting well-being. And I have to say, I hear more and more people have turned to AI and Chat GPT to construct their thoughts. And one of my colleagues spent 2 years on a program or a project or study, and another colleague put the question into AI and came back in about 10 minutes with the exact thing that he had discovered. Thank you very much for being here.
I'm going to turn on my clock here. I have guacamole all over me. Hopefully, I actually had it in my hair as well, which was really interesting. But welcome, everybody. My name is Chris Vandenberg. I'm from Colorado, but as you can probably tell, I am not from Colorado. I'm from, where am I from? North Carolina originally. I've kind of lived all over the place. So I wanted to talk to you today about AI. How many of you in here are comfortable with artificial intelligence and AI? Ooh, some strong hands over here. I love seeing that. It was probably about a year and a half ago that I sat in a faculty meeting when we started talking about AI, and people were like whispering it, and our students are using AI. And I'm like, well, what is this whole AI thing? It's not a robot doing their papers. Why is everybody so uncomfortable? So I have really embraced AI in both academia as well as practice. And I wanted to share with you how you can integrate some AI, some of the basic understanding of it to help boost well-being as a leader, a nursing leader. Okay, let's see if I can get this thing going right. Maybe. You said the big green arrow. Okay. So here are our learning objectives. Number one, we're going to detect how AI can actually detect burnout by analyzing work patterns, communication, and behavioral data. And then looking at some specific tools using AI to help reduce nursing workload, and how integrating AI helps nurses thrive and improve patient outcomes. So let's start with the current crisis. How many of you in here have been a burned out nurse? I was probably burned out 10 months after starting. Just a little background, I was a diploma nurse when I was 20 years old. That was a very long time ago, 35 years ago. And then I went back to get my bachelor's degree, back to get another master's degree, another master's degree, another master's degree, and then my doctorate. You know why? Because I was burned out in nursing and I was always looking for something more. So I think we can all agree that nursing burnout has been happening for a long time. The American Nurses Association reports that 62% of nurses are burned out. How many of you would probably agree with that? Yeah. So common causes are excessive documentation, understaffing, and moral distress. I remember back in the day, and it still happens, where they're like, guess what, everybody, we're going to have a pizza party. And I remember thinking, I hate pizza. I don't want a pizza party. And then probably it wasn't too long ago, I was working as a nurse manager in a psychiatric facility. And my boss came to me and said, guess what, we're going to offer everybody massages for, just how hard work they do. And I thought, oh, that's amazing. We're going to give them gift cards. What are we doing? She said, no, we're bringing in somebody. They're going to set up over here and they're going to do like 5-minute back rubs. And I said, while they work? And she said, yeah. And I thought, gosh, what are we doing? This is not helping with nursing burnout. I don't know about you, but I want to get a massage. I want to take off my clothes and I want to lay on a table, and I'm not doing it at the hospital. Okay. So we know that's not a healthy or sustainable way to decrease nursing burnout. So how can we use AI to detect nursing burnout? That's the big thing. I mean, we all know it's there, but we need the numbers. We need the data. We need all of that to be able to apply for grants. We know it costs a lot of money. Every time something comes out, people say, well, we can't afford it. We can't afford it. This AI program is wonderful, but our hospital can't afford it. How many of you in here remember that day when we always said, we're going to be doing paper charting forever because we can't afford an EMR? Can you even imagine what that would be like now not to have an electronic health record or medical record? This is where AI is going to. AI will be integrated within your hospitals in some kind of way. So it can help detect burnout signs before a person even recognizes them. For instance, we have natural language processing, or NLP, that can flag tone shifts in documentation, showing that someone's frustrated or that they really don't even want to fully, well, we were always taught don't write a whole sentence when you document, but now you can even pick up when they're saying the same things, a nurse is saying the same thing over and over about every patient. In other words, not really paying attention to what they're doing because they're burned out. And some electronic medical records can integrate tools to monitor login times, overtime, and skipped breaks. There was a hospital in Seattle, and I can't remember the name of which one it is, used a system to create alerts for staff well-being teams, catching burnout before it resulted in resignations. So AI tools can optimize nursing workload. They predict staff needs based on patient acuity and past census trends. I remember personally, I was working as a nurse manager and even a nursing director, trying to figure out how do I best balance everything. I wish there was something I could just put in prompts. I didn't know the word prompts then, but that's a big word in AI now, is to be able to put in prompts. So someone else, some computer, something smarter than me could figure out how to make my staffing assignments so people weren't getting burned out. Tools like Kronos, and I'm not promoting any certain tools here, but there is one called Kronos, Kronos, that's used for AI for shift scheduling. It factors in nurse fatigue and fairness, and it can also help transcribe nurse-patient interactions and completing documentation, and we'll talk about that more in a minute. But that saves hours per week, giving nurses back time to rest, to think critically, and not just sitting there typing the same thing over and over, and maybe being able to pay attention to their patients. So when we look at real-time AI, mental health, so this kind of transitions really nicely that you all were talking about therapists and the importance of mental health. We want to have good mental health well-being. I remember probably about 10 years ago when I started, I was working at a hospital, I started having nurses call out, I'm taking a mental health day. That was the big thing. How many of you had taken a mental health day? I'd like to take a couple. Okay, but that was the big thing. I'm taking a mental health day for me. So they weren't coming to work. And I thought to myself, what are we doing wrong? Why do our nurses, mine working in psychiatry, not have what they need here to be able to take care of their own mental well-being? So we started implementing a lot of different strategies. But today, there's a lot of programs out there, AI programs, like there's one called, it's WYSA, and it offers AI-guided CBT exercises, so cognitive behavioral therapy, journaling prompts, and emotional support 24/7. And there was a study in an ER where nurses use these apps. Of course, it was I think a DMP student that did the study, and it showed that 35 to 38% of these nurses working in the ER, by using this type of AI program, were able to lower their perceived stress. So imagine going into work, and it might sound kind of silly, you're taking care of a patient and you've got just everything going on, and you feel like you just really didn't even do what you set out to do as a nurse that day. Get in your car, get your phone, and start speaking in it. You know, like, oh my gosh, I had a patient today with a trach, and I totally forgot they had a trach. And I said, can you say something to me? Or I don't know, I can't remember back then in med surg, but you're saying all these things that are bothering you. Like, I had a horrible day. I can't believe I didn't make a medical error. And guess what? That AI talks back to you. It says, you know what, Chris, you did a really good job today. It must be really hard taking care of those patients. And I know that sounds silly, but my students, they're using Chat GPT to get feedback. My patients, they're using Chat GPT to get feedback. I had a patient tell me the other day they had some type of tool on their phone, and they were able to tell AI, I'm frustrated. I'm mad at my family. I don't want to go home. How can I reword what I'm feeling and thinking? And on the drive home, this AI generator was able to communicate with that person and help them um, settle down, calm down. I know it sounds kind of silly and far-fetched for some of us, but I promise you it's happening. These tools are private, scalable, and cost-effective for institutions. There are many people out there now developing AI programs to help with nurse staffing and documentation that they're offering free trials. Take advantage of those. Take advantage of whatever you can to see what it looks like so you can start to get data to perhaps get the money to implement it. So these are a couple of just real case studies. Hold on, I took some notes here I want to tell you. Give me a minute. So the first one had to do with scheduling and reducing nurse fatigue and absenteeism. So it looked at leveraging artificial intelligence, and there were four or five key findings. First one being reduction in nurse fatigue. So AI-based scheduling systems analyzed various factors such as shift patterns, workload intensity, and individual nurse preferences. I never see that anymore. I remember working, I was a med surg, just so you know, I'm a psych MP and a FMP, DMP. And so I've done my share of med surg, and I remember thinking, I don't want to take care of a patient with a trach. Take all the colostomies, all the big wounds, I'll take anything, but I don't want to do trachs. I don't like it. Guess what? It didn't matter. I was expected, you're a nurse and you're expected to deal with it. And I thought, well, why don't I have to birth babies? Why don't I have to rub the fundus, whoever was talking about that earlier? That's all I remember too. Why can't I have some say in what I'm comfortable with and what I'm not? And so some of these AI programs allow nurses to actually put in the prompts. What do you like taking care of? And be able to check it off. And then it can generate. I didn't do that, sir. And then it can generate, the AI messed up right there. It can generate your staffing based on people's preferences. So we know there was a decrease in absenteeism in the study. Promoting fair and transparent scheduling helped nurses want to come to work. If you know what you're about to get into, like this keeps going off. Am I touching something? Oh, okay. All right. And then improved work balance. AI-driven scheduling tools accommodate individual nurse practitioner, like we said, their preferences, but also things just like their days off. What do they want? I remember those people who were like, I want to do all my shifts in a row and then have off like 2 weeks. And I thought, well, you'll be seeing me later on for psychiatry. But I preferably like to work 2 days, take a day off, work a day, take a day off. But everybody's really different with that. So the last key in that study was operational efficiency. So automating the scheduling process reduces administrative burdens. And I think we can all agree to that. There's probably some of you in here like me who I remember my nurse manager, the first time I was a nurse, she put it on this big board and she was constantly putting white out and moving. And it took hours and hours and hours for her to come up with that. The second study on here, I don't know where we are now. I think I moved ahead when we did that. But anyway, the second study had to do with AI chatbots. And it looked at a group of psychiatric nurse practitioners and how chatbots could interact with them during their shift. So as they're charting on a patient or it sees that they've been given a lot of medications, it can say something like, it's time to take a coffee break. How many of you have ever had a rental car that tells you that? I had that. I presented in Houston yesterday and drove to Dallas, and it told me 5 times, you need to take a coffee break. And I was like, are they detecting? Like, who's watching me? Am I driving too slow, driving too fast? What am I doing? Who knows what that AI was detecting? But I will tell you that I had 3 coffee breaks. They weren't coffee, but I thought, well, heck, it's telling me to pull over, so I might as well. So those AI chat boxes, as silly as they may sound that come up when we're documenting, can be quite beneficial for our nurses to help decrease burnout and well-being. And the third study looked at what most people are familiar with AI in the healthcare setting is automated documentation support. So there's some nurse practitioners in here. I know he's the psych nurse practitioner. Anybody use AI for documentation? Oh my word, I use it every single day. You do too. I will tell you, I have 728 patients in my private practice. Guess how many of them opted out of me using AI? Zero. None of them care. They're like, I'd rather you chart better because I asked some people, this is what's going to happen. It's going to record what you're saying, what I'm saying, and take the main things and put them together. And over time, you train AI to do what you want. If you haven't figured it out by now, I'm a talker, I'm sarcastic, I add in all kinds of things. Guess what? My AI program does not pick it up. It does not say that I have guacamole all over my pants and document that into the patient's chart. It is quite fascinating how you can train AI programs to help. We will be using these in the hospital. We will be using this in doctor's offices already all over. And our students, my students, they're going to expect that you integrate AI into their job because they are using it now. Who's professors in here? Yeah, they're using it. And I'm embracing it because I know they're using it. I'm embracing it myself. I did it the other day. I used a rubric to help me grade papers. I graded the papers on my own. I read them, and then I put my own rubric, the student's paper, into ChatGPT, and I said, here is my grading and my thoughts. Please expand on it and help me with my grading. And AI went in and it picked up some other stuff, and I thought, which I didn't even think about that, but that's a very valid point. So we need to look at AI as being something that assists us, not something that is replacing. Okay, now I think I might be on the right page. Yeah. So there are ethical and practical challenges that come along. Many people are scared of AI. They're like, I don't want a computer listening to me, taking over. Well, I promise you, your phone laying right there is doing some kind of AI program now, because I guarantee guacamole is going to come up on my phone later today. So we're already prone to having different types of AI programs listening to us, hearing us. So let's make it into what we want it to be. There are ethical concerns, though, including data privacy. For example, I told every single one of my patients that I was using AI to help me. And again, all of my patients said that was okay and signed that waiver. So we can protect ourselves that way. There's a risk of bias and there's a fear of dehumanizing care. And I think that's probably where the biggest fear lies with AI for most people. Also, if AI flags burnout, okay, if it's looking at the tone and how someone's documenting it, says, oh, Nurse Jackie, I don't know where I came up with that. Nurse Jackie is burned out. Well, guess what? If you don't do anything about it, it doesn't matter, right? So that's where you get those doctoral students to take on a project. You mentor them and take on a project and get them to figure out, what do we do when it flags burnout? So institutions do have to act on what they see, and nurses should not feel watched. That is a big one that I hear, and we do it all the time. Everybody's listening to us, they can hear us, they can see us. And if hospitals or doctors' offices or whatever, if they implement these AI programs, it's just someone micromanaging me and someone watching me. And we really need to shift that paradigm of thinking more to that's someone helping you, not someone, but something helping you. They should feel supported. And we also need training programs so nurses know how to use these tools confidently. Confidently. I actually went to a presentation. It was a nurse practitioner presentation where someone did a whole presentation on how to write prompts into AI programs. And I'm like, oh my gosh, now I got to learn something else, get another a prompt certificate or something. But we have to make sure that we're training everybody to use this, not just throw it out there as this is going to help you. Good luck, figure it out. So again, our goal is not to replace nurses, it's enhancing their experience, thinking of AI as the co-pilot, not the captain. It handles the routine, allowing nurses to focus on what we wanted to do, empathy, intuition, and patient connection. Think of it again as that clinical companionship because we know it's predictive, it can be consistent, and the best part is it can be unbiased. AI could even suggest when a nurse should take a break based on biometric data. I talked to you about that earlier, and protecting well-being and patient safety. So to wrap it up here, I think we all could agree that burnout is a system issue, but AI does afford scalable solutions. So if you get the opportunity to talk to someone about AI, don't run away, embrace it, learn how it can help your staff, and start by auditing where your staff is spending their time. Where are they spending the most time at? I mean, obviously, documentation, especially for a nurse practitioner, as a psychiatric nurse practitioner, there's nothing more important to my patients for me to sit there and look at them, even if it's telehealth sometimes, look at them and listen to them instead of type, 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 click, 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 return, return. Well, that's the old typewriter, but you know what I mean. So pilot one AI supportive intervention. This is my challenge to you. Pick one thing and roll with it and see how it helps, whether that's documentation, scheduling, or a mental health app. And again, I will promise you the new generation that's coming up, they don't think it's goofy to talk to their phones about how they're feeling. Matter of fact, I had a student the other day, horrible breakup, and I was talking to her about it, and she said, well, I got this breakup app on my phone. I'm like, what? And she does. She's like, oh, I hate him so much. Blah, blah, blah. And, she talks to her phone and tells her all these things she wanted to tell her ex-boyfriend. And then it processes back to her. I can tell you're really angry. What I'd like you to do right now is take a shower and then come back and here's the prompt and write in your journal. And she goes, it's been so helpful. It's amazing how quick I'm getting over this guy. Now, we wouldn't, 20 years ago, I'd have been like, are y'all talking Jetson talk here? I mean, what is happening? You don't know who the Jetsons are, I'm sorry. Okay. So we want support from leadership. We want proper training. And we want to bring back humanity into healthcare. There's nothing like being able to listen and take care of your patients and not feel like you gotta sit there and document every single thing because you've got a companion, you've got an assistant with you helping you do it. And there are my references. They represent the backbone of this presentation. So definitely encourage you to explore them further and how you can advocate in your workplace. And that is the end. Questions? Oh, over there. Hi.
That one here.
It's
Thank you so much. Are you aware of any large EMR systems that already have AI, or is it something that would have to be like integrated on top of? Or
so
is it like a
Epic
Epic
has
is
already
already?
started to implement AI.
Okay.
There's a lot, Athena, I believe. I don't know. There's a lot. The question was, is there an EHR, EMR that has already started to embrace AI? There's a lot of different ones.
So Epic would you would have to have that version, I would assume.
Yeah, I would assume you'd have to have that version, but you can trial things.
Yeah, yeah.
Always
Good
get
to know.
things to trial.
Thank
Yeah.
you.
You're welcome. Yeah.
There are very many systems that you can integrate into Epic that work with Epic and the other.
So we may be a little behind.
Excellent.
And my colleagues can correct me if I'm wrong, because there's a lot of them here in the room with me. I'm aware of and can think of off the top of my head at UT Southwestern, we have Epic. And I can think of 2 pilots that are going on right now that
Wonderful.
incorporate AI in Epic. One of which is one of the inpatient units is using it to plan assignments for nurses. That's the most recent one that I'm aware of. And then on the ambulatory side, recording the conversation
Right.
between the provider and the patient and helping it to make them notes really quickly. And I believe there's also AI component to the My Chart and helping to like sort the messages and go through them really quickly.
So
Actually,
wonderful. Like triaging the messages, like making what's more important, or
yes, something like that. They're
oh,
piloting that.
she goes something like that. Yeah,
Something like that.
that's awesome. Any other questions? Yes.
Hi, so I'm actually getting my MSN in like digital health for
Oh,
nurses.
wonderful.
So this is like super cool. But I feel like when I talk to my professors, that were in this space, it's very like, and in conversations like this, everyone's really excited about it. However, when you try to put it in practice or you try to talk to people about it, it's like a very big culture like shift
It
to the
is.
point where some people think like AI is considered like cheating or
Mhm.
you're not smart if you use it versus my husband's a software engineer and they actually have like prompt management degrees and certificates. So what do you think would be like the big change for us to look at as a nurse? Like we're also scientists and also could do
Sure.
prompts and also can
I mean, I just think
integrate
putting
this.
out the data and showing how it's beneficial to all of us as professors. I mean, literally a year ago, the faculty I work with, they were all like, oh, no one can use AI. And now it's like, how do we use it? How do we embrace it? How is it going to help us? But we've been through so many different culture changes in nursing. I mean, paper chart. I mean, I wore a white cap when I graduated from nursing school, and I don't feel like I'm that ancient. So we have really, really evolved in nursing. So I think just embracing it and trying to present data, how it can be helpful.
So I'll just tell you, my whole leadership team was against AI until they each had to write a policy in 2 hours, 2 policies, 2 to 3 policies in 2 hours. And I made them do that. Now they're all using AI. But it was the same thing. They said, we're cheating. And I said, you have to learn how to use this to make your life easier. I said, shall I bring everyone typewriters tomorrow? I mean, it is evolution. And if you don't understand it, how do you help your students use it in an ethical manner?
Right. Yeah. I mean, there was a time when I was in nursing school, we would go to the library and you would read about esophagogastroduodenoscopy. I remember that one because I got in trouble because I didn't know it. And she asked me a lot of questions, and I'm like, that's all the articles I can find in the library. Now, what do our students do? They Google, they find all this information. So, this is just our expectations are just going to get higher. And I believe we're all just going to be better practitioners because of it as well.
I was at a conference where they were talking about it was kind of like all AI, and I almost felt like it was a little much. But the conversation was around if we don't put ourselves in those conversations, then you're missing that whole piece of the puzzle in the nursing perspective. So like junk in, junk out, that's kind of how AI works. And so I think if we change the conversation to like this is where we're headed, and if we're not a part of the conversation, then the nursing voice is left out of what's coming for AI.
Absolutely. Thank you for sharing that. Yes. Anything else?
I guess that was an Amber Alert.
Yeah, Amber Alert.
So with AI on top.
Probably AI somehow is generated.